Good evening, interns and tutors and colleagues from the office. Welcome to our first intern and tutor feedback workshop for 2025. My name is Tabang Sorolela, and I'm a manager in the CPD and registration department. Please take note of the welcome message that is displayed on the screen. And in addition to what is displayed there, I just want to indicate that we won't have a break in between. So the presentation slides are not that many. I hope we can all cope without a break. And then secondly, please note that the presentation will be done by the assessors and moderators of Intern POE entries. So they will introduce themselves as they coming in. And again, please note that there will be a survey at the end of the presentation. You are kindly requested to complete it because it will also be used as a proof of attendance. Even if you don't have much information to share with the office, if you can just provide your personal details so that we can have a proof that you have attended the workshop. And then lastly, I'm encouraging you to stay with us until the end of the workshop so that you can get all the information you need to improve the quality of the entries that you are submitting so that you can be competent and be able to sit for the coming exam. I wish you all the best, the workshop. Thank you.
Good evening, interns and tutors and colleagues. Thank you for joining us tonight. So my name is Dr. Yanda Yubar. I'm a moderator of POE's activities for interns. And with me, who's also going to present, is Professor Benny Pariachi. She's also a moderator. And then Mr. Mladetsi Makadu, who's an assessor. And we are going to share with you a few things that we have seen while we were assessing and moderating. So first we're going to just a quick overview of the session. Why do we have it? How the structure will look. Then some common mistakes and omissions that we see. This will be linked to the Pharmacist Intern portfolio on the CPD system. And then we will also help you to know how to do things better. Then we will specifically look at problematic competency standards. Again, it's linked to the Pharmacist Intern portfolio and how to do things better. Then quick on the way forward, and then you have time to ask us all your burning questions that you have, and we will try to answer them to the best of our ability. With the common mistakes and omissions, we will look at generic issues that we see, and then when we focus on the competency standard, it will be more specific issues that we have seen. Okay, so in February and March, you will remember we had the intern tutor training sessions. Those sessions are content heavy. It's a lot of information that we give you. And most and often it is difficult to see the relevance before you have the actual involvement with the activities and the competency standards and the portfolio of evidence. But by this time, most of you and all of you are familiar with the system, with the format and the requirements of the competency standards, and you have received feedback from assessors, either positive and some negative. And we are now able to share our experiences and what we have seen that you have submitted this year. So just quickly think to yourself, how are you feeling tonight attending this workshop and knowing that it is about the portfolio of evidence? Maybe you are crying, maybe you are angry, maybe you are confused, but I hope that there's a lot of you also here that feels that you are fine and smiling and happy, and are just here to see if you are on the right track. So with this slide, I would just like to show how we link this presentation to the workshop that was presented in February and March. So you will see there's that little B with a speech bubble, and there's a slide number. So whenever you see that little fellow there with the slide number, it shows or it indicates to the slide number in the intern workshop, the intern portfolio on the CPD system, that workshop that was held in February and March. So each error that we see is cross-linked by a slide number to the previous workshop, so that you can go and look back again. What did we say there? How should you do it? And what do we see now? So this is just how we have structured this workshop. Okay, and then the mistakes and the solutions. So you will see on your left-hand side that little B with a red, looks like a stop sign with a cross in. That one tells you that this will be the description of the common errors that we see. And the happy little B on the right-hand side is the one that will give you guidelines and suggestions how to avoid the problems or how to fix the errors that you've made. So this is just how we have, how you can identify where's the mistakes and what do we suggest. Where it is appropriate and where it's needed, we have also provided specific reference to the tutor and messages for the tutors, which are also included here. You will also see that there's that speech bubble that that indicate. You see here, slide number 84 to 86 is where the role of the tutor was discussed in the February and March workshop. Okay, so let's start with the mistakes and omissions, the generic issues. We're going to look at each of the 4 phases in the cycle, and we're going to identify the common errors. Most important that you must remember is to make sure that you enter the information against the correct phase. It does happen that we see that there's some planning into the reflection, or that there's some implementation in the planning or implementation in the evaluation. So make sure that when you write the reflection, that it is only focused on your learning need, what you want to achieve, etc. So make sure about that. You can go and look on slide 11 in the previous workshop. So when we talk about the reflection title, often we see that the title is not related to the competency standard, that it's the direct wording of the competency standard or even the behavioral statements. It's not descriptive of the planned activity, and it only addresses one behavioral statement in the title, or that it is too long. I have seen titles where the intern provided the first paragraph of the reflection as the title. So make sure that your title reflects the competency standard, and that it includes a description of your activity, but that it is still concise and that it is in your own words. That is very important. And ask yourself, is it original? Is it descriptive and related to the competency standard? It is when you want to read a book. If you see a book on the bookshelf and the book's title is Birds of South Africa or whatever, you won't expect to find any information on lions or elephants. You will find information on birds. So it must be the same if you look at the reflection or at the title. Then when we go to the reflection, make sure that your chosen competency standard is the correct one for your learning need. You must include a trigger incident. In other words, what happened that caused you to identify your learning need? You should also focus on the competency and the behavioral statements. So you need to tell us, what do you need to learn in terms of the skills that's needed for the competency standards? Often here we see that the interns focus on say, for example, you want to do pharmacist-initiated therapy, competence standard 2.6, and the patient complain about a cough and a blocked nose, and now your whole learning need focuses on you need to learn about flu medication. That is not the focus. The focus should be you need to learn how to provide pharmacist-initiated therapy. So make sure that you focus on the skill that you want to obtain or want to gain, and not the case that you are using for that skill. If it is providing counseling to a patient, and your case is a patient that needs to use an asthma inhaler, then your learning need should not be focused on how to talk to someone about an asthma inhaler or how to show someone how to use an asthma inhaler. Your learning need is you want to know how to provide counseling. Because in the end, when you do the evaluation, you need to provide an example of how you have applied that new skill. So your skill was counseling, not asthma or diabetes or whatever the case might be. And remember that it is important to say what you will do with what you have learned. What do you hope to achieve after you have addressed this learning need that you have? Um, Overall, we saw that the reflections was not that bad, that it was um, done well, but there are still a number of interns that focus on the activity and not the skill. So ask yourself again, what do I need to know and what do I need to be able to do? Then when we move to the planning, um, we are still seeing that the planning is not based or linked to the behavioral statements, and that the planning is written in the present or the past tense. Remember, it should be in the future tense because you are planning what you want to do. And sometimes you also don't indicate how you will achieve the skill you describe in the reflection section. So don't only provide information on the resources, but also on the skill. If you want to show us that you can do compounding, don't only focus on the GPP and the SOP, also focus on the skill that you will learn. How do you plan to obtain the skill? The same for competence standard 1.1. How do you plan to provide advice on disease prevention and control? How do you plan to provide advice about healthy lifestyles? So, not just the topic and not just the resources, but also the skill. And remember that you should include specific details to your resources, for example, the page numbers or the section numbers that you're going to use, and include why do you want to use the GPP? Why do you want to use the SOP? So the rationale for using that specific resource. Important to remember, the planning is not only what you are going to do, but why are you using the chosen resources. So it's very important that you look at that. And again, you can go and look in the previous presentation, the workshop, by slides 18 to 20, where we discussed the planning in detail. Then also remember that your planning should be descriptive of the activity that you're going to do and not a general description that is superficial and insufficient. We also see that interns struggle to differentiate between planning and implementation, and often it results in a duplication, or the whole planning is just copied and pasted into the implementation phase. But the planning should be talking to the implementation, and that we don't often see. So make sure that your planning is specific, that it is not general, and that it is descriptive of the activity that you want to do or planning to do. So again, ask yourself, did I write my planning in future tense? Did I provide the reasoning behind the resources? Did I provide specific details of resources, and is it linked to 75% and above of the behavioral statements. Remember, if there's only 1, 2, or 3 behavioral statements, you need to address all of them, and only for more than 4, you can only, or there's a requirement that you have to address at least 75% of them. Implementation, we often see that it is not supported by evidence. In the text, you say what you did or what was done, but you don't provide any evidence to support that, or you provide evidence with no description to it. There's no link to the evidence in your implementation discussion. There's no link to the behavioral statements in the implementation discussion. We'll see there's an example. I applied the SOP in the implementation, and the evidence shows just an unannotated SOP. If you just put the SOP there, then you don't show us that you have applied the SOP. So make sure that you provide evidence for all the resources that you've mentioned in the planning and the implementation. Make sure that you include links to the evidence in the discussion part of your implementation, as well as links to the behavioral statements. And important, the completion date. In the implementation, you need to select or type in the implementation date or the completion date. Remember that completion date must be the date after you have actually completed the activity. So after the counseling you have done, or after the extemporaneous compound that you made. So it must be after that. You can't put your completion date in December, but you submit your activity now, because then you say, I'm only going to achieve this in December, but I'm done now. So that's not feasible. So it must be, make sure about the dates that you include there. Again, ask yourself, what have I done? Where did this happen? When did it happen? How did it happen? Did I reference the evidence? And did I link it to at least 75% of the behavioral statements? And now I know you're going to sit there and you're going to think, how must we do this in 1,000 characters? But it is possible. Trust me, it's possible. I've seen it. It happens when you're not sure and you have a long argument. If you make it short and to the point, then 1,000 characters is more than enough. Now the evidence. And in slide 32, we in the February and March workshop, we spoke in length about the evidence. And what we see and what you should not do is provide blanket evidence for the complete competence standard or for more than one behavioral statement. And this happens especially with competence standard 1.1. You will put your poster or your pamphlet that you designed, and then you will say, with this evidence, I address behavioral statements A, B, C, and D. And then you don't indicate which part on your pamphlet or your poster do you link to A and why is that, or to B, or to C. And a poster and a pamphlet cannot be linked or cannot provide evidence that you have participated in a public health campaign. It shows that you've maybe designed the poster, but it does not show us that you have participated. So make sure that you don't provide blanket evidence and that you provide evidence for each separate behavioral statement. If you have less than 75% of the behavioral statements covered, you will have insufficient evidence. Also, we see that some interns use the same evidence in multiple competency standards. And again, I just want to stress that it is not the resources. You may use the GPP in all your activities if you think you can do that, but not the same prescription for 5.3 and 3.4 and another one. So it must be different cases or scenarios for the different competency standards. So don't use the same evidence over and over again. and then we still see a lot of patient confidentiality that was breached. And remember that the patient's information hide in different places. It's not just on the prescription. It is on trailer labels, it's on labels, it's in the Schedule 6 register, it's attendance registers, script copies. So there's a lot of places where you need to make sure that you don't breach patient confidentiality. And it's important to consider each behavioral statement as a standalone activity, especially for competency standard 5.3. A lot of interns, and we will speak about that later, only focus on Schedule 6, while that is 5.3 is much broader than just Schedule 6, but we will get to that one later on. So make sure to provide evidence for each separate behavioral statement and err on the side of caution. Rather add more pieces of evidence, but with proper annotation and linking to the behavioral statements, because you can still achieve the requirement met even if one piece of evidence is rejected. So if the assessor tells you that this piece of evidence that you've provided here does not prove that you have done this or does not prove that behavioral statement, but you have addressed all the others, then you can still be successful in that activity or with that activity. So make sure that you have enough evidence to make sure that you cover a sufficient number of behavioral statements. I always tell my interns, rather address all of them. Don't go and count here or 4, so I need for 3, and I'm going to pick A, C, and D, and then that's fine. So make sure that you rather address all of them. Because if one piece is not there or is not accepted, you can still be successful. So we said 75% of the behavioral statements must be provided if there are 4 or more behavioral statements in a competency standard. So here's just a guideline that we compiled. So if you have 4 behavioral statements, then the number of evidence needed that is of good quality, valid, sufficient, and authentic for the competency standard is for 3 of the behavioral statements. If you have 5 behavioral statements, you need to address 4 of them. If you have 6, then you need to address 5. If you have 7, then you need to address 5. And then the last one, if you have 9 behavioral statements, then you have to at least provide evidence for 7 of them, evidence that is of good quality, valid, sufficient, and authentic. You will need 7 pieces of evidence. But again, it must be annotated and it must be linked. Okay, if we move to annotation, we often see insufficient or no annotation that is messy or unclear, or we see ambiguous labeling of evidence, and evidence that is annotated as relevant to multiple behavioral statements, or there's a lack of linkage to the behavioral statements. There's no highlights as to which part of the uploaded document is relevant. The other day, again, I saw I think it was the SIMF that was uploaded, a section of the SIMF, but the intern did not highlight which part was used, did not annotate, just put a blanket annotation to say that I checked for side effects and I checked for indications and contraindications, and he listed a lot of stuff there, but he did not indicate on the document where he have checked that. The same with a product information leaflet or an SOP. An important or we see that you need to ensure you show application of the evidence. That often does not happen. For example, with Competence Standard 4.6, you need to show us how the evidence was applied for the SOP and the policy. In other words, if you provide the SOP, then a lot of interns focus on the first part where they say that the intern must comply with the SOP, and it's up to date, and a lot of that. And when it actually comes to the steps that you must follow, then it's just selected steps that is highlighted. Remember, you need to show us how you have applied the complete SOP from the first step to the last step, not just steps in between that you think, and cross-link it back. If you have the steps, then for step 1, if it says you must check the vehicle when it arrives, if it's stopped, if it's a receiving of stock, then yes, then you have a photo of the truck arriving with the door that is sealed, and you link it to step 1. So you must do that. So make sure that each piece of evidence is linked to a specific behavioral statement. Make sure that your annotation is detailed and neat. Show how the evidence meet the requirements of each behavioral statement. So say that I have linked this part to provide advice on healthy lifestyle because, and then you say why you have included it there. Avoid using A, B, C, etc. as evidence labels. Rather refer to the specific behavioral statements. Sometimes you get confused with the numbering and the actual wording, and then you think it's there and then it is not there. Link separate pieces of evidence for each behavioral statement. Again, clearly show which part of the uploaded evidence is relevant. Include the title, the date, and the verification. For example, attendance registers. If you have did some screening for 1.1 and you have did some blood pressure measurements and glucose measurements, and you have the patients that to sign the attendance register, make sure that it is clearly on the attendance register the date, the place, the time, who conducted this these screening tests or provided the information. And again, pay attention to confidentiality, and remember that it does not apply to doctors or colleagues that work with you. Inappropriate evidence, when it is long and unannotated excerpts from reference material, if it's invalid evidence, if it's not authentic, if it is not legible or blurry, if it is uploaded incorrectly or arranged in an illogical manner, or submitted in multiple documents. We said that in the beginning, you must have all your evidence must be submitted as one PDF document. And unfortunately, if I cannot read the evidence, then I cannot assess it. And the previous cycle, I had a few submissions where I was not able, even if I enlarged the PDF, I was not able, if you enlarge it, it just gets more blurry and you cannot read anything. Then I cannot moderate or assess that. So make sure that it is legible. Ensure that your evidence is authentic, that it is not made up. Often with resubmissions, I mean, if you did a campaign in February, but you did not have or did not include an attendance register, and you resubmit the exact same activity in May, and suddenly here pops out the attendance register, then we ask ourselves, it just puts a big question mark that it is made up and that it was not authentic. Ensure that your evidence is valid, that it is relevant to the competency standard, that it is accurate and logical, and that it is factually correct, so that there's no calculation errors, etc. And most important, to annotate or link the relevance of the uploaded material to a specific behavioral statement. We have said this in the in the workshop in the beginning of the year. And again, this is really important because it needs to tell the story. And with the annotation and the link, you tell the story of why this evidence is there and what does it show. Then the last step is the evaluation. And there's a lot of incomplete entries there. And please go again and look at slide 26 to 28. When you write your evaluation, that's the last step. You need to say or tell us how have you applied the new competency or the new skill that you have obtained. I said in the beginning when we talked about the reflection, I want to learn how to counsel a patient. Now I need to learn. Now I must say, okay, a few days later, a patient came to the pharmacy with something totally, it must be totally different. And I was able to counsel the patient because I now knew how to counsel a patient, how to listen actively, how to get the relevant information from the patient and to tell them the relevant information. So it must be about the skill that you have gained. You must tell us how has it impacted my practice and how. Explain to us. You must also say, what have I learned? And remember again, it must all be related to the skill that you have mastered. So what have I learned about counseling? What did I learn about compounding? What did I learn about health promotion and disease prevention? So what did I learn about the skill that I've gained? And what is your future learning needs in terms of the skill? It should be, it should not be our, say for example, you did counseling to a patient with insulin, and now your future learning need is I still need to learn how to counsel patients using an inhaler. You have mastered counseling now, so what other aspects of counseling are there? You can also your future learning need can also be related to the domain in which you are. So if your activity was counseling, then you cannot say my future learning need is to learn how to do proper research. So it's got nothing to do with the domain where counseling is in. So it can be related to the competency standard or the domain that was selected. Then again, just remember your example need to be different from the implementation. It should occur after the implementation, and don't just say something like, I was able to counsel a patient again. Be specific with the examples that you use. And as I've said, it should not only refer to the activity that was undertaken, but to the skill, and it must be relevant to the competence standard and its related behavioral statements. Okay, then just a few comments on writing style. Here, the tutors need to provide feedback on writing style errors. The tutor should verify the activity online, and it is expected of the tutor to read through the whole activity and to look for inappropriate language use or incomplete sentences, and advise the intern on that so that they can correct that. Because we are professionals, so we want to have a professional writing style. Make sure that your work was proofread, and that all your sentences are complete, that you used capital letters at the beginning of a sentence. You won't fail if that is not there. If you type I, if you want to say I did this, and your I is with a it's not capital letter. We won't fail you on that, but it's not professional writing. So make sure that your writing style is correct. And please, the tutors need to help or assist the interns here. I know that English is a lot of the interns' first language is not English. It's also not my first language. You have probably noticed that. So we do struggle, and that is why we need assistance from people that just another eye to look at it and help me with my writing style and my language and the words that I use. One that I see often, and I think that it can just be a typing error or it can be an autocorrect, is I talk to the staff at the hospital or the pharmacy, and then that staff is spelled stuff, STUFF. So it is simple errors like that. So just check for spelling and language errors, etc. Remember, if you breach patient confidentiality, it is an automatic not yet competent or not yet successful outcome that you have. Breach of patient confidentiality is also a serious breach of professionalism. And as I've said previously, watch out for patient details in places other than labels. And this includes all means by which patients can be identified, photos and signatures. If the signature is such that you cannot make out that the person's surname is Van der Merwe or Hubert or whatever, then you can leave the signature there. If you put text boxes over the patient's details to obscure it, make sure that those boxes don't move when you convert the document to a PDF or to the PDF version. So make sure that you can also first convert to PDF and then put in the text boxes to obscure the patient details if you're worried that it's going to move. So, but just check for that as well. And again, go and have a look at slide 67 for confidentiality. And then resubmissions, again, we get a lot of entries that's resubmitted without any changes being made. Please, again, for the tutors, if your intern need to resubmit, please check that the entry has been improved before validating or verifying a resubmission. And for the interns, please never ignore the assessor's comments. Do not bank or think that the shortcomings that you had will be ignored the second time that you submit. And then you need to decide if your not yet competent or not yet successful entry needs amendment or if it needs replacement. Remember also that each submission or resubmission is assessed as a complete standalone entry. So if you just add evidence in a second document, then and I know I also do that. I see that, okay, document 1 was this upload date, so I can see when it was uploaded. Now the upload date of the first document is 20 February, and the upload date for the second document is 1st of May. I'm not going to look at the first one. I'm going to look at the last one, the latest one. So if you've just added pages there, then it's still not going to be correct. So remove the old evidence and do resubmit your evidence again, the corrected evidence. And then also change the date of completion to the new date. Yes, so make sure that you address the comments. Often, if it was breach of patient confidentiality, it can be fixed. If that was the only thing, if the assessor said that the evidence is good, however, you've breached patient confidentiality, you need to fix this, and you fix that, then you can resubmit that one again. If it was compounding, or it was counseling, or it was pharmacist-initiated therapy, or ethical and legal practice, you will need to start over. If you didn't include your attendance register when you did campaign, you need to do that whole activity over and start over from scratch. Do a new standalone activity, or a new replace that activity. So don't think that we're going to accept it the second time. You might get comments like you are wasting our time, or why don't you read the comments, or previous comments not addressed. So make sure that you address the comments. Then we also see entries resubmitted with incorrect or unacceptable changes. Unfortunately, that happens. And then please don't falsify or create evidence. We've spoken about the attendance registers or patient history. For pharmacist-initiated therapy, you need to provide evidence on the patient history and the background, etc. It was not there, and now suddenly 3 months later, here I have the patient history again. So don't falsify or create that. The same with expiry dates and batch manufacturing records. Rather start over, do this activity from the start, redo it completely. And important that you need to know and be clear about what the assessors or the moderators requires from you when your entry requires resubmission. So make sure that it is clear what you need, and that you understand what you need to improve and do on. Okay, at this moment, I'm going to hand over to Veni, my colleague, who will take you through the next couple of slides. Thanks, Veni.
Thank you, Rianda. I appreciate that. Hi, everybody. My name is Professor Nilavani Padiachi, and I'll be taking you through the next few slides. As Rianda mentioned, I'm also a moderator. So Rianda just covered all of the key areas as assessors and moderators that we found in the last 2 or 3 rounds of assessments this year. So I hope you identified some of the areas that you found challenging, and hopefully you are able to rectify them. So I'm going to be focusing on the problematic competency standards that we've encountered through these last few sessions of assessment and moderating. So what we're going to do is we're going to look at the entries, the complete competency entries, completed ones, read through them, make sure that you understand what the requirements are for that particular competency standard. I think some of the concerns that we have sometimes is that the intern does not seem to understand what the overall competency standard requires of you. So make sure you read through that introduction component that is found in your intern manual. We're going to look at some of the recommended possible challenging. If you remember in your very first intern workshop, the assessors and moderators were quite descriptive in all of the challenging and recommended and possible competency standards that guided you through the process. So if you want a refresher, look at slide 69 of that workshop, and it'll refresh your memory. So consider separating the separate behavioral statements. So have a look at them, make sure you are able to identify each one and what it means in terms of the complete competency standard. So just pay attention, because sometimes what we find is that there is sometimes interns would use one piece of evidence and try to cover multiple behavioral statements. So you're not very clear, and it's difficult as the assessor and moderator to identify exactly which behavioral statement you are targeting. So try and look at them in isolation when you are finding out the evidence or trying to obtain evidence that is suitable for that particular behavioral statement. And then ask yourself, can you provide evidence for these behavioral statements based on the competency standard that you've chosen? So prior to actually conducting that particular competency standard that you've chosen, get an idea of what type of evidence that's the planning component. So you have an idea of where you're going to look, what are you going to look for, and align to the behavioral statements and with the evidence as well. Next slide. So the very first domain is domain 1, and I'm sure everybody's familiar with it because it was one of the most common domains that were submitted in this last few rounds. So if you recall, public health is domain 1. Within that public health domain, 1.1 is the most common one that interns choose. So remember, as to refresh your memory, it implies targeting a particular audience, and it's a larger community audience. So it has to be a large group of people, not a single person that you are targeting when it comes to public health. Remember that the purpose of this particular campaign is to showcase your skills within the public health area. So how are you able to gather information and provide information to a larger audience? Because you want your campaign to reach a large amount of people, and you want to see some form of outcome from that health campaign. So remember to think clearly about what constitutes a particular health promotion campaign, and look at primary healthcare as well. So when you look at the steps of the basic steps of what a health campaign looks like, you'll see in that diagram, that flow diagram, it says, firstly, you need to identify the health need. So what is the need within that community? Prepare what intervention you are going to execute within that community to address that particular healthcare need. So the intervention could be a poster, a PowerPoint presentation, it could be information leaflets, however you choose to execute that particular health campaign. And then you're going to deliver that intervention to that targeted audience. So remember, your audience, it needs to align and it needs to reflect what you're trying to get across in terms of your health campaign. So sometimes what we find in health campaigns is that, for example, the information is directed at pregnant women, but when the pictures are shown in terms of the audience, we see males in the audience, majority males in the audience. So it doesn't align to the information that you are delivering based on the health campaign that you are saying that you are delivering. So be cautious, be aware of how you're executing that particular intervention, and make sure your audience is the targeted audience that you want to execute that information to. It has to be relevant. Remember, it must bring about depth and understanding and showcase that you are actually understanding what you are delivering and who the audience is. These skills, remember, you're going to be using for the rest of your career. So make sure you try to master them right from the beginning. And then the last step is to assess the intervention of that campaign. How effective was it? And there's a multitude of ways that you could do it. You could ask for you can ask them to fill out a questionnaire. You could have a tick box exercise where you ask them specific questions related to the health campaign and they can answer it. So it's really up to you, but showing how effective that campaign is important. Next slide. So going into specifics of 1.1. So remember, 1.1 has 4 behavioral statements, and it is around the promotion of health and wellness. And as Rihanna has just mentioned, remember, what we want to be able to see throughout all of the competency standards is your ability to execute the skill. So yes, showing how you gather information on TB or HIV, whatever the topic that you have chosen is important. But what is the skill that you've learned from gathering all of this information and executing that particular public health campaign? So the problems that we find within this particular domain, or what we found for the past cycle, was the campaign was not targeted to a large audience or group of people. It was rather targeted to an individual, where it was just a single person standing in front of a poster, and that was submitted as evidence to show promotion of health and wellness within public domain 1, competency standard 1.1. Or the pictures showcased colleagues. You can do a public health campaign to colleagues, but it must be relevant. It must have a large audience, for example, as well. So it's important that you show that. Randomly chosen target audience not relevant to the health message. As I said before, we found where the delivery was, the topic was around pregnancy, but it was actually delivered to males. So yes, males are considered to be, we want our male our males to be involved in the pregnancy process, but in terms of information and healthcare, etc. But your target audience should reflect that they are mainly women. So be careful of that. Group work submitted. So when you, and if you recall from the earlier presentations workshop in the year, group work submission is something that we're seeing happen through submissions in the last few rounds, but make sure that your component is very clear in the group submission, and you want to show and execute all of the behavioral statements that is relevant to this particular competency standard. So we can't evaluate you if you haven't provided evidence for all of the behavioral statements within 1.1. So be aware of that, showcase exactly how you've executed that particular competency standard. And then no mention of the skill learned. So the exercise is purely focused on be it TB, HIV, etc., but there's no mention of what skill did you learn as an individual through the promotion of health and wellness. Tell us, did you learn how to become more confident? Did you learn how to propel your voice during the counseling, the demonstration of the promotion of health? Whatever skill you may have learned through that process. Did you learn how to find information easily? So what advice we would give you is, don't forget, domain 1 is all about public health. Show how you interacted with the target audience. So don't just stand there with a picture of you holding a poster. Show us exactly how did you communicate the information across. Provide evidence that is relevant to that, how you interacted with the audience. Describe how you developed the materials. So how did you meet health promotion requirements? How did you get the relevant health message across to the audience? Remember to include sufficient activities to constitute a health campaign and link it to the behavioral statements, and only submit your own contribution to that particular activity. So what some of the common mistakes that I found during marking the last moderation cycle was, for example, if you look at providing advice on healthy lifestyles, which you see in the behavioral statement, sometimes interns don't show that or don't reflect that in the evidence that they provide. They will just annotate the entire poster and say A, B, C, D has been met, or ABC has been met, but don't tell us exactly where is healthy lifestyles, where is disease prevention and control, and where is health promotion within that poster. We want to be able to see how you deliver that. Remember, it's about telling a story, and we want to see the evidence of that story that you're telling. Next slide. So the next common one was 2.2. So 2.2 is from domain 2 and patient counseling. So the problems that we found here was no evidence of communication with patients was provided. So how did you communicate with the patient? And you can see, if you look at the behavioral statements at the bottom there, 2.2, communication is quite a common theme across all of those behavioral statements. So we want to be able to see, in order to counsel, you have to be able to communicate. So how did you communicate? What type of active and reflective listening techniques did you use? How did you use body language? Did you use verbal and nonverbal cues during your communication? So reflect that to us and show us evidence. If you could, for example, show us information on what that means to you and how you deliver that. So understanding what nonverbal and verbal cues are, but then relaying that information to us when you're describing it in the activity. Focus is only on the medicine. So instead of focusing on the actual patient counseling, we find that interns focus more on what was the drugs that they actually counsel the patient on. So they will focus on the ibuprofen, the paracetamol, the cough syrup, etc. So instead of focusing on patient counseling, it's more directed towards the medicine. Unverified dialogue is used as evidence, so articles and patient information leaflets are given with no linkage to specific behavioral statements. So there's information that is provided that's really not relevant to any of the behavioral statements, or even if it is, we don't know where it fits in. It doesn't tell us the story of exactly where that particular piece of evidence goes when it comes to the behavioral statement. Many pieces of evidence that are submitted, but no links to behavioral statement, as I said earlier. and many behavioral statements are not met. So often we find, and as Rianda showed you earlier, the table on the expectation of 75% and more, where the minimum is 75 pieces of evidence for the behavioral statements. Make sure you follow that rule in terms of the pieces of evidence that you need to submit. So it's a common problem where we find interns are submitting evidence but does not meet the 75% requirement of that competency standard, especially for the long ones, for example, 2.2, where we have A to I behavioral statements. So just be cognizant of that. Make sure that you are fulfilling the 75%. Remember, don't just submit evidence. It must link to a behavioral statement. It must tell us the story, and it must provide depth to your understanding so we can see that you are competent within that competency standard. So how do we help you? What solutions we can advise you on is first to establish the patient's understanding. So when you're counseling a patient, you want to be able to show us, so what questions did you ask the patient? What information did you get from the patient? If you take a detailed history, show us, tell us, this is the information that the patient has provided. Now that I have an understanding of what the expectation of the patient is, I can now deliver counseling and providing relevant information to the patient. So include the patient feedback, which is dated and signed to verify that counseling actually took place. Your notes should be given during the counseling session as evidence. What did you ask and what did you tell the patient? So what information did you gather and what information did you tell the patient based on the information that you received? And then have a patient-specific counseling plan. And I'm sure and during your undergraduate years from the relevant institutions that you come from, you've come across counseling plans. If not, have a look online. You'll be able to find multiple counseling plans to guide you on how do you provide a specific counseling plan to a patient. Focus on the interaction with the patient, so evidence of the actual counseling, and not only on the medicine. So sometimes what we see is pictures of ibuprofen, pictures of Benylin with codeine, pictures of chronic medicines, whatever it may be. But there's no information around how you interacted with the patient based on what you have learned from that individual or based on the script, whatever it may be. Remember that an uploaded photo does not prove that counseling has taken place. So you don't, by showing us a picture, it really is meaningless evidence. We want to be able to understand that by whatever evidence that you've provided, how does it link to a particular behavioral statement? We want to say, how is that picture relevant to that behavioral statement? Tell us, explain to us. So you just standing in front of a patient really doesn't provide any depth of information to us as a moderator or an assessor. You could be standing, it could be next to your friend, it could be next to your tutor. We don't know. We really don't know who that person is that you're standing next to. So it really is meaningless evidence. So make sure that your evidence really is providing some value towards the behavioral statement and understanding and showcasing your competence. Check that sufficient behavioral statements are covered. As I said, 75% must be covered. Include active and reflective listening. So one of the things that was glaring during the last few rounds of submissions on 2.2 was the lack of information around active and reflective listening. So it's really difficult to be able to showcase without providing a video, but tell us what you understand by active and reflective listening, and tell us in the description, how did you execute those principles around active and reflective listening? So did you lean in, for example? Did you use body language? Did you repeat, for example, or did you ask the patient to repeat? Those kind of simple things where you're actually showing to us that you have applied those active and reflective listening skills that you've learned. So note to show application of these skills that you submitted as evidence. So you must be able to show us how you've executed that. Thanks, Rianda. So this is an example of, it's a busy slide, but the purpose of this particular slide really is it came from one of the assessors as an idea. And remember, Rihanna was saying to you earlier, when it comes to explaining counseling, the focus generally the intern is on the insulin pen or the asthma pump. You'll see on the yellow component of the mind map, where the focus is really on the insulin pen and asthma pump. But what the assessors moderators really would like to see is how are you performing that skill of counseling? So when you look at the green and you look at the orange and you look at the purple components of this particular mind map, those are the areas we want you to focus on. So we want you to focus on the use of nonverbal and verbal skills, active and reflective listening techniques, establishing patient understanding, establishing a patient rapport. And I'm sure you remember all of this from your undergraduate years. How do you establish rapport with a patient? Tell us, how did you make sure that you obtain sufficient information? How did you get a history from the patient? Tell us more about understanding the needs of the patient. Tailor whatever information you are going to give based on what the patient is needing during that counseling session. So these are the core areas we want to see come out when you are discussing a counseling plan for a patient around 2.2. So this is the depth of information, because really what you're trying to prove to us is that you are competent in counseling a patient. So make sure that you fulfill all of these requirements, and these are all coming from straight from the behavioral statements of 2.2. It's nothing foreign. It really is based on the behavioral statement. So it's just a guide. You can come back to the slide when you have some time, but this is the type of information that we are looking for when we assess and moderate. Thanks, Diana. So 2.6 is your pharmacist-initiated therapy. So this is all of your over-the-counter medicines. So remember, when you're looking at over-the-counter medicines, there are so many skills that you want to be able to showcase that proves your competence. You want to be able to see that that you can take a detailed history. So are you taking a sufficient detailed history? We don't want you to just be where the patient comes in, asks for a Benylin for flu, and you just grab it off the counter and you give it. That's not our purpose. That's not the reason we are pharmacists. So we want to see, how do you take a detailed patient history? And often that's what's missing. We don't see interns providing us with a history that is detailed, where you ask the relevant questions aligning to whatever condition that the patient is presenting with. So dialogue submitted as evidence. So you'll have interns who will submit their name and then the patient, and they'll say, hello, patient, hello, good morning, and the conversation will continue. It really, again, it could be falsified, made up information. We don't know. So it's really poor evidence to submit a dialogue which really has no substance for us. It could have been AI generated. So really doesn't give us any depth of whether you understand how to counsel or how to manage a pharmacist-initiated therapy. So remember, with pharmacist-initiated therapy, there's no reason for a prescription. It has to be initiated by the pharmacist or the patient coming in for a particular condition. We don't need a script for this particular competency standard 2.6. Behavioral statement D, the referral component, you can see D on this left corner there, referring patients when required to an appropriate health provider or resource. And often that's something that's missing. So remember here, there's 4 behavioral statements. You want to fulfill the 75%. So you have to provide evidence on the referral component when it comes to submitting evidence. Who did you refer the patient to, and based on what? Is the cough very chesty? Is there fever that's presenting that you're concerned about? Is there pus coming out of the ear? Whatever the reason is that you need to refer. So you must substantiate by providing evidence there. The focus is on information gathering on the condition and treatment, not on sharing this with the patient. So what we find often as evidence here as well is that there's submission of, for example, an Adcodol or an ibuprofen or any antidiarrheal medicine, constipation medicine, but the focus is really just on the actual product of the medicine, where we'll see submissions of a SAMF on, for example, loperamide. But really the focus here is, if you look at the behavioral statements, what is the signs and symptoms? What are the objective signs and symptoms around pharmacist-initiated therapy? What are the appropriate medicines in relation to the medical history and the allergies and the patient preferences, etc.? So we want to see that type of level of engagement when it comes to discussions around pharmacist-initiated therapy. So what suggestions we would provide is to go beyond merely just saying that the patient history was taken, which often happens. Rather, you provide patient responses in terms of giving us a patient detailed history on what discussions was happening around with the patient, and provide your evaluation of that history based on what discussion happened and what choice of treatment you decided to go with and why. The dialogue, if submitted, must be verified. So if you are providing a dialogue as part of your evidence to substantiate what you've already said, which is not the sole evidence, you can get it verified by your tutor, who your tutor can authenticate and say that it's actually what truly transpired during that conversation. Remember that pharmacist-initiated therapy is guided by a patient's subjective and objective signs. So signs and symptoms are important. We want to see what questions did you ask, what are the signs and symptoms, and how did you come up with that particular diagnosis for that patient, and then the referral. Thanks, Yanda. 3.4 is medicine dispensing. So this is also a very common one that is chosen by interns, which we saw. And the biggest concern around this one is, again, because it's so many behavioral statements, we find that it's insufficient evidence to suit the 75% that is required. So often only behavioral statement A, which is the prescription validation, is covered. E and F, which is your preparing of extemporaneous preparation, so your compounding, and then performing pharmaceutical calculations, is missing when it comes to submission of 3.4. Outdated or incorrect references used for prescription validity and authenticity. So remember, Regulation 33 is the regulation that you need to look for in terms of authenticity and validity of a prescription. So that has changed in recent times. I'm not sure exactly which year, but make sure you get the most recent and most current legislation around that authenticity and validity of prescription. If you're providing an outdated one, it immediately will not fare well with the assessors and moderators, and it compromises your submission. Antibiotic reconstitution is sometimes considered by as compounding. Remember, extemporaneous compounding is quite a detailed process where you would have to reflect all of the different components of batch numbers, expiry date, how you mixed it, what are the ingredients, what are the calculations that go with it. And an antibiotic reconstitution does not align to compounding. So just be careful of that. Determination of the number of doses to dispense is considered to be a pharmaceutical calculation. So if it says take one tablet 3 times a day, for example, for 5 days, that calculation is seen as a pharmaceutical calculation. But what we're actually looking for here, when you're compounding your mixture, if you're using 10% beta-methazone in UEA, explain to us how you get that 10%. Explain to us how you reach that 100 grams. So those types of calculations is what we want to see when you are explaining this component of 3.4 behavioral statement E and F. References regarding dosages and appropriateness of medication are not submitted. So make sure that your references for whatever information you're submitting is aligned to some form of scientific resource, be it your SAMF, be it your daily drug use, whatever pediatric dosing, etc. So make sure you provide the relevant references. So how do we solve these common problems that we've been finding? Is it's important to consider the behavioral statement requirements as standalone activities. If you look at them, remember to look at them in isolation. So provide evidence for each of the behavioral statements and treat them as a standalone behavioral statement. Make sure that you use the latest references. If including extemporaneous compounding, make sure the expiry date is correct. And if you go back to your workshop at the beginning of the year on the expiry date, it's quite detailed there. And references must be submitted and annotated to the relevant behavioral statement that you are providing. Remember, if it's multitude of behavioral statements like this competency standard, you have to be clear to the assessor and moderator for us to be able to deem you competent. So you must align your evidence to your behavioral statement. Thanks, yeah. Okay, 3.5. So compounding is also a very, very common and popular competency standard. And I think the problem, not a problem, the reason why it's often chosen is because it's just a single behavioral statement, and that could be misleading because it's a single behavioral statement, it's deemed to be easy, but actually it's not. So thinking that this is an easy competency standard because there's only one behavioral statement, ignoring the requirement to apply pharmaceutical knowledge. So if you look at domain 3.5, just going to try it for you. And it's very clear on the description of what it says. It says applying pharmaceutical knowledge to the formulation and compounding of medicines. And that's the description of the behavioral statement. So you have to show application of pharmaceutical knowledge in the formulation and compounding. So that's often missing or incorrect expiry date for compounded products. Steps of the compounding process is missing. Calculations are incorrect with the CPD, therefore making the CPD invalid. No compounding guidelines included, so no reference to the GMP, GPP, SOP, etc. The Intern give their formulations. There's no correct expiry dates based on Regulation 3 of the Medicines Act. So go and have a look at expiry dates on Regulation 3. And the interns do not always know the difference between a 1 in 4 dilution and a 1:4 dilution. So just if you're not sure, that's what your tutor is there for, to be able to assist you, to guide you through the process. So how do you correct the common problems we see in compounding 3.5? It is definitely not an easy competency standard, as I said. It needs to be annotated with relevant reference materials, including, or resources, including your standard operating procedures. So your SOPs, your batch manufacturing records are important. Resources such as your good manufacturing practice, your good pharmacy practice, all of that information to support what you're saying and what you're doing based on the pictures that you provide for this particular exercise. So the evidence must prove your action. So each step by step, often it's a detailed description of the very beginning of cleaning out your compounding extemporaneous area, for example, showcasing the hot and cold tap, showcasing the scale, how you calibrated, how you measured, showcasing the batch manufacturing records, how you came about the expiry date, how you're recording the batch details, etc. So you must show us evidence of all of the detailed steps of how you compounded that particular product. So follow Regulation 3 of the Act 101 of 1965 for expiry dates. So if your institution for some reason uses longer expiry dates, comment on how this does not fulfill the regulation. So sometimes you follow a particular guideline based on the SOP of that institution, but if Regulation 3 is saying different from what your institution is saying, you have the opportunity to say to us, this is the reason why this particular expiry date is so, but according to the Regulation 3, Act 101 of 1965, this is what it says. And we want to be able to see that you understand the reasoning behind why the expiry date is supposed to be 30 days or whatever it may be, and how it's different from your institution. So it's okay to be able to identify errors that you may find within your institution. We want to see the reasoning, the critical thinking that you apply when you're doing your competency standards. Ensure that all steps of the compounding process follows pharmaceutical principles, and all of these steps are submitted in a detailed fashion, sequential manner. Calculations must be checked very carefully before you submit them to make sure your tutor verifies and checks that the calculations are correct. Include compounding guidelines and annotate all of these compounding guidelines. Remember, you don't want to just submit a whole SOP. You want to show exactly which part of the SOP applied to this particular exercise that you are fulfilling. If you're applying or using the GPP, same thing. We want to see which part of the GPP did you apply when you used when you executed the compounding competency standard. Note that Regulation 10 refers to labeling. So one of the things that we picked up in the last round was around magic mouthwash. So this is a mouthwash that I think, if I'm not mistaken, is commonly made in public institutions. which is a great formulation, but what's missing is the labeling information around what the content of that mouthwash is. So that's a common mistake that we find. How are you, even though the label does not print all the details, according to Regulation 8, you should actually defend it and say, this is how it should be. And this is the information that needs to go in based on Regulation 10. And maybe you can engage with your RP or your tutor to ask them, maybe we need to relook at this particular SOP around or the batch manufacturing information around magic mouthwash to be able to change it so it complies with Regulation 10. So just remember, all ingredients, whatever you're compounding, must be visible on that label to inform the patient who may come across that particular compounded mixture. They know exactly what went into it. And then verify these processes using relevant resources like your pharmacopoeias and your codex, Martin, whatever resource that you have, you must have access to within the pharmacy. You can further validate that information by using these resources. Next one. So 4.6 is my last one that I'm going to be discussing before I hand you over to my colleague. And SOPs and policies are also a very popular competency standard that's chosen. But before I go to 4.6, I want to just touch on 4.2, which is financial management, that one of the assessors mentioned, where it's often what we find that financial management is geared towards generic substitution. And remember that financial management is not only about generic substitution. If you look at the behavioral statement, it looks at submitting patient prescription claims to health funders to ensure optimum use of patient benefits. So looking at a formulary from a medical aid, working according to an approved budget based on their savings and whatever their profile is with their medical aid, complying with all of the relevant legislative prescripts, and performing cost-benefit analysis. So it's quite an in-depth, detailed type of competency standard that you really need to, from a drug utilization perspective, a drug utilization review pharmacist will be able to conduct this particular competency standard. So the common mistake we find here is that the intern believes that it's just based on generic substitution, where pricing is the consideration, where the original is more expensive than the generic. And that's the discussion around this particular 4.2. And that's why interns tend to become non-compliant on this, not yet competent, on this particular competency standard. So 4.6 is the policy one. So there has been improvement on the policy over the past few submissions. However, the biggest challenge that we're facing as assessors and moderators is the application of those SOPs and policy. Remember, there's just two behavioral statements here. The first one is application of an SOP, and the second one is application of a policy. So often what interns do is they submit a really detailed, well-written SOP, and they submit a relevant policy like the national drug policy, which has become very popular. However, there is no information on how did you apply that national drug policy within your pharmacy. If you're using procurement and storage as an example, how did you use the principles of the national drug policy and apply that within your facility when it came to procurement and distribution or storage? Same with the SOP. So you provide an SOP on procurement, on storage, you're looking at temperature, etc. How did you actually show that in your pharmacy you are checking the temperature, that it is within 2 to 8 degrees within your fridge, that it is at 25 degrees in the room, etc.? So how did you apply that SOP and how did you apply that policy is missing within 4.6. So please, if you could remember to just show us how did you apply, and then that will make you competent within this particular competency standard. Remember, as a note, just as a last comment, is that the GWP, the good wholesale practice, and the good pharmacy practice is not seen as a policy. So please don't add that as evidence of a policy. It will not be accepted and you will fail that competency standard. I'm now going to hand you over to my colleague Mr. Mercado. Hi, Mr. Mercado, are you there?
Yes, Nilaveni.
Thank you, Mikado.
Okay, good evening. My name is Mulatezi Makado. I'm one of the assessors. So I'll be taking you through on the last few slides, starting with domain number 5, like what my colleague have been saying. In this domain 5.3 in particular, there are 5 behavioral statements, meaning that you need to be found competent in 4 of them. So normally, what we see when you guys submit the portfolios, I mean the CPDs, the most common thing is that most of you submit the dispensing of Schedule 6 prescriptions, and it's not only about this. There are many examples that can be used as well in proving or in showing how this particular competence that can be articulated. So in most cases, like I said, so we commonly see the dispensing of Schedule 6 prescriptions. And then when it comes to the legislations, this is one of the competence standard where you need to, or the PS will talk about the Pharmacy Act, the MRSA, and also the latest version of the legislation. So in most cases here, we see interns quoting the legislation, which is like outdated, or maybe the one for 2010, 2008, to satisfy BS number C. And BS number C in particular, it is talking more about the latest legislation. So I think these are the areas where we found common mistakes among the interns. So what is needed here is the latest information from the legislation. Like, for example, this year we're in 2025. So if you can quote something maybe done last year towards the end of the year, and if you have any recent information about the legislation amendment for this particular year, I think that will be appreciated. But putting something for 2012, 2014 at this era, it will not fly. And then in terms of the professional in indemnity insurance, which is linking to BS number D, there are some requirements that are normally being ignored. On the evidence, what is needed is the copy of the professional indemnity insurance. Certainly not the application form submitted, because application form does not really translate into the indemnity cover that you can say, I have indemnity cover. And then there's another part where in terms of the legal compliance, interns normally ignore the other part, because there is legal compliance as well as the ethical consideration. So you need to focus on both the legal and the ethical aspects of the practice. Quite often, you'll see interns referring to the SOP as part of the legislation. It is not. SOP is just a step-by-step guide on how to perform a particular task, and it is not in any way a form of legislation. So okay. Good. Going to the next one, which is 6.2. 6.2 is having 3 behavioral statements. And the most common errors, mistakes that we pick from you as interns is on articulating the 3 BS. Number 1 is more of the teaching plan that you need to develop after maybe consulting or in consultation with guidance from a colleague. So meaning that on the evidence, what is needed from the assessment point of view, we need to see the copy or the teaching plan as an example that yes, for you to be able to meet BSA, you need to provide an example of a teaching plan, which you have probably crafted after consulting with your colleague. And then the teaching plan need to be in detail, like, you should indicate what is on the teaching plan. And in most cases, some interns may even go to the way of, of reading a particular book where they'll say, this is how the teaching plan is crafted, and then they'll annotate that part of information. And then in return, then they will be able to attach a teaching plan. That is what we probably need. Like if maybe you are to teach the participants on TB, will need to know the contents of the teaching plan. We need to know if maybe you're going to be having the session on the question and answering. It should be included in the teaching plan, the date, the venue, whatever. We saw those kind of information. And then when it comes to BS number B, I think this is where there are so many problems. BSB is about the interns developing or performing the self-assessment on the topic that they want to train the participants. The self-assessment is not for the participants. In most cases, interns write about this as is meant for the participants. The self-assessment, if you read the BS very well, it will say that you need to perform the self-assessment to identify your own learning need, not for the participants. And in this case, when you talk about self-assessment, this is where if maybe you'll be teaching about the TB, you will have some questions about the TB on how far are you in terms of the knowledge. But obviously, to be able to satisfy this BS, there's no way where, in the self-assessment, some of the questions, then there will be no, some of the questions will be yes. And then on the no questions, this is where you will go and read further so that by the time you conduct this training, you will have addressed whatever the gaps were. So in this case, I think interns sometimes fail to understand this. And then the last one, it is the BS number C, which is the development of the learning need, which in most cases we refer, or when we put comments, we'll say in this particular BS, the best way to showcase how you will have done this is to show through the quiz, as you can see at the bottom, the role play, the multiple choice question. So in this, for you to be able to satisfy the BS, we need to see the quiz, the multiple choice question, the role play done by participants. And then when you put the evidence, there's no point of you having the register for 10 participants. But when it comes now to demonstrate or to showcase what the participants did to satisfy BS number C, you only put an example of a multiple choice question done by one participant. When in the register you had, I think that the mistake that we want to give it to you is do not give us the only one example of a quiz from the participants. I think 2, 3, or 2 or 3, I think will do. I think we've already indicated that this self-assessment on the right, remember that this is relevant to the formal education of students in most cases, for this particular CS, 6.2, you will see interns talking about training their colleagues, whatever way. But I think this is the information we need to give it to you. Going to 6.3, remember that this is relevant to formal education of students. So colleagues do not fulfill this particular criteria. So provide evidence of the course or the module into which your training fits. So this is, I think you can go to the next slide. Next slide, please. The other area that we need to give you feedback on is on the plagiarism. You know that under evaluation, this is where you need to attach your report that you will have gone through via Turnitin. So the message to you is ensure that the plagiarism report is attached. At this point of moment, we recommend that the plagiarism report should be less than 20%. And then we are seeing cases 75%. I think day before yesterday, I've seen 200%. Those kind of issues. So the question is, I think the message is, make sure that you go through your document before you can submit. Make sure that you correct whatever duplicate as may be coming from your report. Of course, there are some common ways that will always form part of the plagiarism report, like the GPP, because almost everyone may be quoting GPP, the Medicine Act as well. Those ones we understand. But in the event where, for example, here, possible future learning needs and application of a new skill. So this is how you will be telling us as to how are you going to apply the knowledge that you have gained, and then you describe that. So if in that particular instance, there's a similarity. So that is why we're saying, no, that one is a big no, if picked under similarity. So I think this is what I want to share with you on similarity. Message is make sure that you read the document and then make sure that it is below 20%. Okay. The last two slides is one of them is the way forward towards the success. Like we've been telling you from the beginning, we want you to read the entire competence standard carefully. The way some of the CPDs, as we are reading the information you put, it is, it clearly indicates that someone probably did not read the competence standards. So we're encouraging you to read all of them before you could even attempt the CPD. And then the behavior statements, it depends. I think Nilaveni and Rihanna did tell you that you need to make 70% of the BS. If there are 4, then 3 of them need to be met. So for you to be able to do that, you need to show clearly through annotation how did you achieve that. I think Nilaveni said to you, which I'm going to repeat, that this issue of writing one sentence and then you link it to multiple BS without giving more information on how they were achieved, I think it doesn't work well. So show us clearly how each and every BS was achieved. And the best way to do that is to do them one by one, not in multiples. And then we always say to you, consult the training presentation. We did train you at the beginning of the year. So those presentations you can always refer to. And then pay attention to assessor feedback. Quite often, the system is so good that these days, if an assessor put a comment today, that comment will always be appearing every time when you submit the CPD. So one can see that, okay, in March, This is the comment I wrote to the intern. The intern didn't address it. We copy that comment just to remind you that, by the way, in March, we have given you this comment. You didn't address it. And then come May, we read your document and we still see that you have not addressed it. So the system has been crafted in such a way that it will be able to show those comments. So colleagues, the message to you is please read the comments. We try by all means to write as much detailed information so that you guys, you can be able to understand what you need to correct. Thank you. We can move on to the next one. For the tutors, I think their responsibilities is to encourage you interns to meet the deadlines. Omulalo will be talking about the deadlines. I think the slide after this one, she'll be talking to you on the deadlines that you guys you need to adhere to or to know. I remember that entry validations needs you to check maybe before it can be given to the tutor. And then the tutors are advised to also stay involved and then make sure that all phases are completed and entered into the correct place. Make sure that the evidence that you are submitting is valid, is not outdated, is not upside down, is sometimes blurry. You want to check the expiry date. If it's within 30 days, then you cannot see anything. So I think this is something that we are saying to you, please check before you can upload that document, because if you cannot see it or it's not clear from your side, there's no way where it will be clear from other. And when we do not see it clearly, there's no way where we can make a proper judgment. The likelihood is it will be returned to you. Before a resubmission, the assessor's comments are okay. Make sure that the assessor's comments are resolved. As I've told you, that we give ourselves time to write all these comments, so they are meant for you to read, so that when you resubmit, everything should be okay. I think the next slide will be for Mulalo. Thank you very much. Mulalo, over.
Sorry, Mr. Makado. I think you can continue.
No problem. Thank you, Watabang, for that. Colleagues, these are the dates that you need to be aware of, more in particular as you are moving towards your August examination, which is going to be on the 5th and on the 6th of August, the Tuesday and the Wednesday. The first, the bookings for you is opening on the 23rd of June this year. I think this is the date that you need to be aware of. And then it's going to be closing. And then from the 11th of July, it will be now considered a late booking. Remember, the bookings are opening on the 23rd of June. And then from the 11th of July, when you book, you will be considered to be doing late booking, which these late bookings, they are going to close on the 23rd of July. Yes, we have put the heading as late bookings, late booking. So late booking for 11th of July, and the other one is the closing of the late bookings, which is going to be on the 23rd of July. And the same will apply for the October examination. But what we wanted to make you aware here is that the exam booking must be done online before the closing date. Then the late booking, which are starting on the 11th of July, they will be accompanied by a fee, or a fee will be charged after the closing date. And then the other thing that maybe I need to inform you here is I think the extension of the submission date. let me just read this information to you, colleagues, and then I think I should be done with. Yeah, please note that submission deadlines for the CPD entries were extended. Interns should submit for tutor verification on or before the 6th, which is today is the 4th. So interns should submit for tutor verification or before 6 June 2025. So this is the new information for you. And tutors should submit for assessment by the 9th of June 2025. Thank you. You can go to the next slide. This slide is the CPG submission deadlines. I think you already have this in your intern tutor manual. The information that I was just giving it to you is just to make you aware about the amendment, especially for this current cycle, since you guys you will also be jostling towards getting your CP submitted so that you can be able to register. So that is why I've just announced maybe those extensions for you, but otherwise the same schedule that you see in here is what is already available in your intern tutor manual. And the next one is going to be any questions. So I'll be handing over this one. Thank you very much.
Okay, thank you, Mr. Makado, and other presenters. So interns, there is a post-workshop survey link that is displayed, and we're requesting you to please complete the survey as we will be busy with the Q&A session. So we will take the first question. Thank you.
The first question, I would like to know what will be evidence for a CPD based on SOP? Hello?
Okay, let me take this one. Not sure what the question, but what I can say here is I'll give an example of 4.6. 4.6 is the one where it will refer to the application of the SOP. Let's say you want to clearly demonstrate how you have used the SOP, and your title is receiving medicines, maybe from the supplier. So you will need to get the SOP for receiving from your facility. And as you do your work, you need to be telling us what the SOP is talking about. And then when you get that stock that coming from the supplier, this is where now you will be applying whatever steps from the SOP, and then you show how did you apply those steps in receiving the consignment. Thank you.
The next question.
Thanks.
Okay.
Sorry, I just want to add to what Mr. Makodi just said. Yes, so I have mentioned it in the part where I spoke about the evidence and the implementation. So you should link every step of the SOP to application evidence. So you should say that, say for example, step 1 of the procurement SOP is that you need to, when they deliver the medicine, you need to check that the delivery vehicle is sealed. And then you give us a photograph of the truck and the door with the seal on, and you say it was sealed, and you annotate and you cross-link, and then you say, okay, this is now step 1. So you will need to have that cross-linking between the SOP and the application evidence. I hope it makes sense.
The next question, can a picture of me be evidence?
I'll answer this one. Yes, a picture of you can be evidence, but it will depend on the situation that you are in. I've seen a picture that the intern provided, and he said, "This is a picture of me listening actively to the patient," which to me doesn't tell me anything. I can't picture that doesn't always say 1,000 words. But yes, if you identify yourself on that picture and you annotate, and it is clear that on the picture and the annotation it corresponds and it's telling what it should, then a picture of you is acceptable. Yes.
Maybe let me add as well, like for domain 1.1, when you are doing the health promotion, normally you will show the picture of yourself standing in front of the people, conducting or showing us that you were the one who were conducting this particular campaign. Of course, if the participants are clients, then you need to hide their faces. So in that way, the picture can indeed show that it was you who was conducting the campaign.
Sorry, can I come in as well? So, in terms of also a picture, I was just thinking if you look at competency standard 3 with 3.5 with the compounding, if you, for example, stand with complete PPE, so if you have a mask or if you have a gown that displays how what you're using prior to compounding, that could also be an example of how you're effectively showing yourself in a picture, but also showcasing that you are geared to provide the compounding exercise appropriately. Thank you.
Can I resubmit a CPD and not change my reflection or evaluation since my moderator did not have any comment or problems with it? Will the new moderator then fail me again because they are not happy with the reflection or evaluation?
I'll take this one. Okay, if you need to change your topic, I'm not sure about the context of your question, what competency standard it was, etc., and what the comments were. But if it's something that you need to change, and you will need to if it was compounding or it was counseling or it was pharmacist initiated therapy, and you need to add a lot of aspects, then you will need to change your reflection and your evaluation. You cannot have the same learning need in February and in May. So it's always better to start over with an activity and to redo it than to try and fix it, unless it is patient confidentiality that was breached. But if it's major things that you need to change, then it's better to start over than to try and panel beat it into. And remember, you have the same assessor and the same moderator for all your entries. You don't get assigned to a new assessor or a new moderator halfway through the year. If I was your moderator for your first submission and you have to resubmit, then I will moderate it again. And usually we try to make the comments in such a way that it is easy to be able to see if something was changed or not. So yes, if it's something small, then, but if it's something really big and you have to add evidence, etc., then it's better to start over. Thank you. Not sure if anyone wants to add to that.
Welcome back. I think you can move to the next one.
What if I submit for the second time after my submission was returned by my tutor and the similarity picks up on my previous submission and is 100%?
Okay, thank you, Noctula. Let me take that one. So in the office, we have picked that the system is picking your, own work as being plagiarized. So we are busy with the developer trying to fix that problem. In the meantime, please interns must submit even if the similarity score is above 20%, and that will be fixed once the developers are done. And we really appreciate, I apologize for that inconvenience. Thank you.
Does it suffice to put the behavioral statement in brackets next to the rationale of the use of a particular evidence?
Yeah. It's always good there's no harm in showing, for example, if you are doing the description to say, this is what I've been reading, maybe I've been reading the Pharmacy Act to fulfill whatever, then you indicate in brackets that this statement that I've written here, it talks to BS A or BS B. I think or in that way, it shows clearly that whatever you're explaining, then you are making us aware that this is relevant to a particular BS, and putting it in brackets, I think is another way of showing it. Thank you.
Apart from dispensing a Schedule 6 drug, what can we do for 5.3?
Okay, I'll take this one. Okay, so 5.3 is you need to practice ethical and legal every day in every situation, not only when you dispense Schedule 6 medication. So again, that's a perfect example of where you can have multiple scenarios, or you can have where you need to look at the behavioral statements as standalone activities. You can maybe do not just focus on Schedule 6, but it can form part of the bigger activity. But yes, every aspect, every action that you take in the pharmacy needs to be based on ethical and legal principles. So it can be the child asking for Adcodols and is underaged, and you need to decide whether what are you going to do? Are you going to sell it to him or her or not? What does the act say? Or scheduling, patient requesting blood pressure medication. You must then. It's also ethical and legal aspects that you need to look at. So, but I think why interns focus on Schedule 6 is it because of the register and the words and the numbers, and there's more aspects relating to the validity of the prescription that you can look at. But everything else in the pharmacy that happen should also be according to ethical and legal practice. Yes, if that makes sense.
Okay, let me add another example. You see in the pharmacy, there are some medications that are available via Section 21. So the process there may need you to apply the Act whatever way. So that's another example that can also be used for that. For example, as well, when you are performing the disposal of the medicines in a pharmacy, medicines need to be disposed according to particular laws and regulations. So those are the other examples that can be used as well. Thank you.
How do we attach a plagiarism or similarity report? I always assume that it's automatically uploaded when we run the similarity check, but I once got a comment from an assessor that I did not submit the similarity report.
Okay, thank you, Noctula. Yes, the similarity report, the interns, they don't have to submit it. Once it is generated, it's made available to the tutor, the assessors, and the moderators. So I'm not sure what would have happened with that intern. Maybe the process of evaluating the work for similarity, maybe it was not completed, or maybe the intern didn't submit. I don't know what might have happened. It means we need to investigate. But the way it is at the evaluation step, you can't submit before you have done the similarity check. So that's why I'm saying I'm not sure what would have happened that made the intern to be able to submit without um, satisfying that step. So we'll need to check that, but they are right. They don't have to upload anything. Once the system has done, they have submitted their entry for similarity check, it will be made available to tutors, assessors, and moderators, like I mentioned. Thank you.
Evening. I need to submit a new CS for domain 4 as told by my assessor, but the system is not allowing me to do a new one as I attempted the domain before and was unsuccessful. Please assist.
Okay, thank you. The intern won't be able to start a new competency standard. So what they need to do is to edit the one that they were assessed on before. Like if the intern submitted 4.2 initially, and maybe the the assessor or the moderator advised the intern maybe to change the entry since it is reflecting more to a particular competency standard than the one they have selected, then in that case, the intern must just edit whatever they have done, and the system will also allow them to change the competency standard. So it's not like they're opening a new one, they're just editing the initial submission that they are having. Thank you.
How do we get in touch with our assessors when we need clarity on their comments without having to resubmit and failing the same POE?
Okay, thank you. On that one, interns must go and check in their manual the process of having a consultation meeting with the assessor is outlined there. And one of the requirements is that the intern should have attempted the same entry twice and being unsuccessful. So the way the internship is structured is that the tutor is the first contact person, meaning when the intern is unsuccessful, they need to go to their tutors for guidance on how to correct and also to respond to the comments from assessors. And if that they fail following the intervention of their tutors, is then that the assessor will come in. So that is the process. It's clearly indicated in the manual as well. It's not like we want them to fail first before they have contact with the assessor, but we acknowledge in the presence of the tutors, and they have been helping interns for so long. So that's the first step that the interns must take. Thank you.
If you're successful in the October exam, will your internship be extended?
Yes, remember the interns are being evaluated on 4 components of pre-registration, and exam is one of them. So if you don't, you are not competent in all of the four component of the pre-registration examination, then you won't be released from the internship role. So interns must just make sure that they meet all the four components. That is, they must make sure that all their progress reports are submitted by their tutors. They must be successful in their examination. They must be competent in the portfolio of entries. And then they must also have completed the 365 days in order for them to be released from internship. Otherwise, the internship will be extended. Thank you.
We need to show applying an SOP and then also show how to apply a policy separately. And must the SOP and policy relate to each other?
Thanks. I will take this question. Yes, you need to show how you applied the SOP, and you also need to show how you applied the policy. But no, it's not necessary that they relate to each other. The SOP can be procurement, and the policy can be. Now I'm stuck on an example. It doesn't need to be the same. If your SOP is procurement, then your policy doesn't need to be procurement as well. It can be two separate things. Thank you.
Let me come in as well. Yeah. Yes, you can have two different settings. So, I mean, for SOP and for the policy, example is you have an SOP for receiving medicines. And then when medicines are received, they are stored and distributed afterwards, which if you read on the NDP, there's a section that tells you how medicine should be stored and how they should be distributed. I think this is where you can be able to apply them. Or you can have a statement where you'll be talking about the receiving of the medication and maybe the disposal. Disposal may need a policy, the receiving may need an SOP. Thank you.
I have made an SOP on management of HPLC waste. On the CPD, what will my evidence be?
May you repeat? Maybe I didn't get it well.
I have made an SOP on a management of HPLC waste. On the CPD, what will my evidence be?
It depends on which competency standard was selected. And then it might only address one of the behavioral statements. I can't remember the exact, I think it's 4.1. Behavioral statement A is development of an SOP, but there's more. So you can have the SOP that you've developed, show how you have developed it, link it with the relevant resources that you have used to compile that SOP, but then you will also have to address the other behavioral statements from that competency standard. Maybe someone, Benny or Mr. McCarty, can add to that.
Thanks, Rianda. So I'm looking at the competency standards, and from what I see, it's linked to 3.6, which is medicine recall, disposal, and destruction. So remember, firstly, this particular competency standard has 3 behavioral statements, which includes recalled medicine, expired, damage, etc. So you'd have to align the evidence to that specific behavioral statement. And in the case of demonstrating waste, SAPRA has guidelines on how to destroy medical waste. The GPP has guidelines, minimum standards on how what's the proper way of destroying medicine, and then of course the Medicines Act and Pharmacy Act as well. So you incorporate all of that pieces of evidence, the relevant components of that evidence, together with the standard operating procedure of the site that you're working at, as part of your evidence. And then if you're using it in the application of an SOP, for example, as Rianda mentioned, then you would demonstrate how you applied that policy. But if you're using it in 3.6, you would have to elaborate using the evidence that you are providing on how it's linked to that behavioral statement. And if you look at 3.6, it's quite comprehensive in terms of medical waste, recall, destruction, etc. So it's quite comprehensive. So that's, I mean, off the top of my head, that's what I can think of. I'm not sure if Makada and Rianda want to add to that. And as Rianda said, it depends on which competency standard you're choosing. Thank you.
Yeah, thank you, Nalavin. Yeah, I mean, it depends on what you have chosen, and based on that, then you can be able to apply what is on the SOP and what is on the policy. It really depend on what have the intern chosen. Like the example I've given. So it depends if you are dealing with the management of a particular case or whatsoever. Then, if you have a policy that can talk to that, then this is how you can be able to apply that. Thank you.
How must we provide evidence of patient counseling since the picture is not sufficient? What would be great evidence?
Let me try this one. A picture alone is not sufficient. I mean, you can talk about the weather, and we won't know that. That is why we say that you need to have the counselling plan that you have provided. You can have an I don't want to call it a consultation sheet, but similar to a page that you can use to if you do pharmacist initiated therapy, where you get the history, etc., where you can then, if you have the plan, how are you going to structure your counseling, then you have a separate one where you ask the patient certain questions while you are busy counseling them, and they give you your answers and you write that down. You have you can have pictures of you actually, if it's, and we've seen that a lot, where when the intern want to provide counseling on the use of an insulin pen, and they have the pen, and they show with photos how they show the patient to get the correct dosage. Then they have the patient demonstrating it back. Then they have the visual guides to help them, where they have the pictures, where they have the product information leaflet. So there's a lot of extras that you can add to the. I mean, you want to see the interaction with the patient, so don't ignore the photos. You can put the photos in, but don't say that this show that I have listened reflective or actively, that I have asked the correct questions. So don't link it to all the behavioral statements. You can have the photo there just to show us that I have actually interacted with the patient, but then all the rest have to support that and make up the evidence. I hope what I said makes sense. Maybe the other two presenters can add to this.
Okay, maybe let me come in again. On the counseling, yes, it depends. There are 9 BS that need to be achieved, and most of them, of course, there's one for listening, there's one for maximizing opportunity, and the other one is for demonstrating sensitivity. I think in terms of listening, like I think it was Nilaveni or you, Rianda, that if you are standing and the patient is over the window, yes, we can see, but it is not entirely like true that maybe that picture mean that you were really communicating. In this case, I think this is where the tutor may also come in, maybe to also witness that, yes, on this particular day in this picture through annotation, that yes, the intern was giving whatever, listening to what the patient was talking. And then in this case, maybe the patient spoke this particular language, and yes, the intern did. I think these are the things that you can do, because for you to be able to demonstrate that, there are many things that you need to look at the existing understanding of the patient knowledge on the condition before you can even counseling. So you can have a checklist in there to check if they really understand and so forth. But again, it depends. I mean, number 9 or number I is more of obtaining the feedback. Others normally do that by having a checklist where they can be able to give the participants and then they complete it. So it depends on which BS you are talking about. Thank you.
For domain 6.2, can I conduct my training on a topic that I have covered in one of the other domains, given that the evidence is different? If the answer is no, why?
Okay. Maybe let me start in here. I'll again give an example of training participants, let's say on DRTB. Domain 6.2 is more of training. So, and then when you go to the other CS, I don't think there will be another one where it will be similar to 6.2, where you can exactly talk about what you did. But it may be something, maybe counseling. Yeah, maybe 2.2, maybe to counsel their patients on how to take their TB medications. And then on 6.2, it could be training the participants on DRTB. That is how I can be able to respond. I think my colleagues can also help. Thank you.
Thanks, Latiti. Yes, I was also now just thinking about an example, and one that I thought of that may work is if you had 1.1 and you did screening, and then your tutor or the supervising pharmacist or the RP realized that the assistant don't know how to take glucose or how to measure blood pressure, and then they've instructed you to provide training, and then you realize that you can do 6.2, because as Mr. Makaru said, 6.2 is about the provision of training and education. So that's the skill that you need to learn. So yes, I think it's possible, but on the other hand, you won't have the same evidence. The evidence for the two will be totally different, because it's two totally different skills that you want to learn and show us that you can do. But and there's so many opportunities and so many cases or triggers that happens that it's in my opinion, it should be unlikely that you don't have 6 totally different activities. But yeah, it will be possible.
If we have submitted 6 CPDs by the 6th of June and need to edit 4 of them to be successful to be allowed to write the exam, can it be redone in the following month?
Sorry, Nectula, may I please repeat the question?
If we submitted 6 CPDs by the 6th of June and need to edit 4 of them to be successful to be allowed to write the first exam, can it be redone in the following month?
Okay, I'm sharing the the slide on the CPD submission deadlines. So now we are on this submission cycle that starts on the 2nd of June, which has been amended or extended. So the results for this cycle, they're supposed to be released on the 25th. So this means that interns who meet the requirements to sit for the pre-reg exam by the 25th, they will be able to book for the pre-reg exams. And then there is another cycle before the 5th and the 6th August exam that is from the 1st of July. So this cycle, that's why it is even highlighted in a different color. So it's just to indicate that interns who are meeting the requirements of the pre-registration examination in July, they will be allowed to book for the pre-reg exam, but they will be expected to pay the late booking penalties. So yeah, I think that's the difference. I'm not sure if I've answered that question fully. Thank you.
Is it possible for the tutor to return the CPDs they have submitted for assessment now that the date is extended? This is after seeing my evidence is not fully done after this workshop.
Yes, when the entry is still with the tutor, remember the tutor has got an option to submit for the entry to be assessed or to return the entry for the intern to make some corrections. So if the entry is still with the tutor, the intern must just notify the tutor that it shouldn't be submitted for assessment, but it be returned to them so that they can do the necessary corrections. Thank you.
Where can we find?
Tabang, sorry. I think this intern meant that the tutor have already verified and submitted for assessment. But then it cannot be, the tutor cannot return it. So if it's not verified, then yes. But if it have been verified and submitted, then no, it cannot be returned. That's how I understood the question.
Yes,
Thank you.
so thank you for that clarity, Rihanna. If the entry has already been submitted, unfortunately, in most cases, we are unable to, because you'll find that by the time the request reaches the office, the assessor has already assessed the entry. So once it has been submitted for assessment, it's difficult. But maybe the intern, I would advise the intern to contact the office tomorrow, and then we will see if we can be able to assist. But in most cases, it's hard to return an entry that has been already assessed. I mean, submitted for assessment. Thank you.
Where can we find new legislation that would be sufficient in a POE?
Let me take this one.
Okay, Benny.
Rihanna, yeah. So if you look on the Pharmacy Council website under publications, all of the latest legislation, all of the changes are all available on the web page. So the Pharmacy Act is there, the board notices for the GPP, any changes that are relevant to the pharmacy profession are on that web page. But if you're looking for more specific on Medicines Act, for example, then you can go onto the SAPRA website and you'd find the latest legislation on the Medicines Act, the act that is the Medicine Act, and also the regulations around the Medicines Act. So those are really two good resources that you can use, and it's easy to access. Thank you.
Do assessors take into consideration that you could have used a certain resource but not included it as evidence because you didn't think it was important and then added as corrected?
I'm not sure I understand the question, but I will try to answer. No, we do not take that into consideration. If you mean you add it when you correct or you resubmit, then we will obviously look at that. But yeah, I'm not sure I understand the question correct. But no, I don't think that if I look at a POE that the intern did not include this because I think it was not relevant. Yeah, but if it's a resubmission, then obviously we look at everything. But Fanny, maybe you can answer
I
better
think
this one.
let me come in because I think sometimes what we see is comments around, for example, legislation that hasn't been included. So if you remember, I think it's 5.3 or is it 3.4 where you have to indicate authenticity and validity of a prescription. Now, in order to do that, you have to quote or provide evidence of the Regulation 33 in the Act. And if that is not provided as supporting evidence to show how you authenticate and validate, then that becomes a piece of a submission that becomes invalid because you haven't referenced the correct resource. You can't reference a resource that does not align to what you're trying to prove. So I think in that instance, that question would apply, and then later it could be corrected by providing evidence. And that's usually aligned to what the comments coming from the assessor and the moderator. I'm not sure, Rianda, if that makes more sense, or maybe Makada, you can add as well as an assessor.
Yes, that makes sense what you said, Fanny.
Yeah, I think from what I remember, I think that would be where the intern is referring to the type of resource that could be missing. But again, I think it depends on the type of assessment, the competency standard that you're choosing. When it comes to regulations and the act, you'd have to be precise in providing the relevant one. That's a no-brainer. You have to show us how you understand the application of the law and keep abreast of what's current. So, for example, like the new scope of practice, and that's a common error we're seeing as well. The scope of practice has changed at the end of last year or sometime last year. So you can't provide old scope of practice of pharmacist assistant, technicians, post-basic, etc. You have to show us the current and the most recent legislation change. So that's an example of it as well. I hope we answered your question.
When I tried to resubmit,
Any? Oh, I wanted to say well covered. I mean, by the example. I mean, there are so many examples that we can talk about. For example, if you talk about the expiry of the medicines, I mean, the Medicine Act will tell you exactly that it need to be within 30 days if it's compounded. So that's the evidence that we'll probably need when they document their writing to indicate that according to whatever, then and then they show us that when they were doing it. Thank you.
Thanks, Mikado.
when I tried to resubmit, my evaluation didn't change. It picked up the previous one. How do we resolve this issue?
Okay, thank you, Noctula. So this is a resubmission, I believe. In this case, the intern shouldn't submit, at least just notify the office so that we can assist you in getting the correct evidence. Otherwise, I mean the correct information for that step. Otherwise, you are going to be marked unsuccessful. So just make sure that you notify the office and we correct it immediately before you submit. Thank you.
So I get one assessor that marks all my CPDs, or do I get one for each submission of a CPD?
You have the same assessor for all your CPDs, whether it's a new submission or a resubmission. It is only in extreme cases where you might have a different assessor, but throughout the year, your assessor will stay the same person. Same with the moderator, unless someone resign. Yes, thank you.
Yeah, or say unless it may be I'm supposed to be assessing now, then something maybe happened that may prevent me from assessing now. Those assessments may be reassigned to another assessor, meaning from the time of reassignment, then or they will continue with the new assessor. But otherwise, in a normal case, when you are assigned an assessor, it will be the same assessor for all your CPDs.
I received my similarity report as 10%, but my assessor replied that my similarity is more 20%. So will it be okay to submit the similarity report as part of my POE?
I think I heard one saying that the system will automatically generate that report. I'm not sure, Tawan, maybe if you can add more, but I heard you saying that it can be able to put that. I'm not sure if maybe they have a second one, the system can also do that. Thank you.
Okay, thank you. So the process is the one that I've explained earlier. So if the intern is happy with everything, then the assessor can submit. Remember, I mentioned that we are having challenges with our similarity detection system at the moment, but that doesn't mean interns mustn't submit. Interns must submit, but if the report is above the required or the acceptable score, then that shouldn't prevent them from submitting for verification and assessment. So they must submit it as is. What is important is for them not to bypass that the submission for similarity detection. So you must just follow the process as is. And then if it's high, leave that to the office. We will fix it when the system is back to normal. Thank you.
For evaluation, we're supposed to give a different scenario of where we applied the skill. But what if you're at a CHC and the only thing compounded is skulls? What other different scenario can I include?
I'm not sure, sorry, Makore, but I'm not sure that you will only compound Scholl solution. Just from my experience, there's a lot of other compounds that you also do. Remember, it doesn't need to be bulk compounding. It can also be for a specific patient, and it can also be bulk. So it depends, but I can't think that you will only compound Scholl solution in your facility. The other option is to ask if you can just do a few hours at the hospital, and then maybe do some compounding there. That's my suggestion that I would make. Thank you.
I also wanted to add that definitely there are lots of items that can be prepared. They are sterile, they are non-sterile, they are ointments, they are solutions. So there are variety. If maybe the pharmacy is not aware of, like Rihanna said, I think you can always check with another pharmacy. But there are lots of preparation that are compounded. So under the applying of the skills, you can indicate that after maybe learning to, gaining knowledge on compounding that particular item, maybe you went on to do another one. That is what we advise. Thank you.
Sorry, I also like to come in, but that also speaks to being prepared for your competency standard that you're going to execute. I think knowing that you have sufficient evidence to be able to show competence in that particular competency standard is up to you. So if you think that you don't have sufficient evidence to showcase that particular behavioral statements within that competency standard, then choose another one. And I think in domain 3, there's quite a few options that you have, like 3.4. So, choose your evidence to align to the competency standard, especially because you want to show competence. And if you can't, then don't opt for that particular competency standard. Choose something that you have robust evidence for. Thank you.
I've developed an SOP on HPLC waste management to do domain 4.6. I would like to know what my evidence will be.
I think this question's been repeated, Naktula.
Yeah,
I think they now just added for which competency standard it was because it was not indicated previously.
Oh, I see. 0.6.
Yeah, but now for 4.6, you need to show how you apply a policy and how you apply an SOP. So if you have developed that SOP, it's fine, but you still need to show us how you have applied the policy and the SOP. So you would then still need to go through the whole SOP step by step and show us how you have applied it. That is what you need to do for 4.6. Maybe Benio Makado can add to that.
Information sufficient, Rianda. Thank you.
Yeah, thanks, Rianda. I think if we give you too much more, we don't want to influence the way you present your evidence as well. So, I mean, you want to be able to show evidence of how you are showcasing that particular SOP. So just be wise in terms of the pictures you use, what type of waste, what documentation you're using, and align that to the legislation and SAPRA guidelines as well. I hope that helps. Thank you.
What if the tutor also doesn't know how to change what the assessor has indicated needs changing?
Okay. Meaning changing in terms of correcting or changing or in terms of the system refusing. But in terms of changing or helping with the comments coming from the assessor, I guess there may be other colleagues within the hospital that can be able to help, if I understood the question correctly. But I believe the system can also be able to allow any changes the way I understand it. Thank you.
Domain 5.3, I attached my student indemnity because I was still applying for my intern one at the time. Now that I have my intern indemnity, should I just update the existing CPD or do I need to redo the CPD?
Okay, I'll take this one. If you have been successful in 5.3, then you don't need to redo it. If you was not successful, then probably it was not just the indemnity. I have never seen an intern that was not successful and it was only due to the indemnity. Usually it's the indemnity plus something else, or it is, yeah. So if it was not successful, you will need to look at what the assessor, the comments made by the assessor or the moderator. If that was one of the aspects, then change it. If there was something else that you had to do over, then do the whole one over. But it will depend on the comments and it will depend on the case or the scenario that you had. Thank you.
Yeah. Yes. Indemnity BSD cannot be the only one that will make them intern not being competent. It will be that one plus another one. Normally, I wanted to say that PSA is talking about Pharmacy Act and Medicine Act. So in that case, we always expect interns to demonstrate how the two of them, not one of them, because it talks about the Pharmacy Act and the Medicine Act, and then the other one. So it cannot only be the indemnity insurance, but in the event that it came back and the indemnity insurance was one of the area highlighted, then submit the new proper one, plus also address whatever the comments were. Thank you.
Registered as an academic intern last year in November. Unfortunately, I'm not ready to write the exam this year. Can I write the exam next year?
Okay, thank you, Noctula. Yes, the intern can write the exam next year. We are aware that academic interns, their internship period is longer than that of the interns in the hospital and community sector and other sectors. So next year is still fine. Remember, for the intern to be able to sit for the pre-reg examination, they should have met the CPD requirements. And in this case of an intern writing next year, because they would have exceeded the 9 months of internship, they are then expected to be successful in all the 6 CPD entries or the portfolio of evidence. I'm sorry. Thank you.
CS 3.6. How would I satisfy BSc if no medication recall occurs or I'm at a hospital pharmacy?
If you cannot address C, then don't select 3.6. Because you cannot do a fictitious recall or this is what I should have done if it was a recall. Then you need to wait for a recall. If you really want to do 3.6, then wait until you have a recall. But I would not select that one. It is difficult to provide the evidence for C. And if it's just this is what I should have done or that I will do, then you won't be successful. So if you don't have it medication recall, don't do 3.6. It's easy as that, actually. Thank you.
The exam is written in October. When will the results of the exam be released? And if in August, when will the results be released?
I can take this. So as indicated in the manual, the examination results are released within 8 weeks of the exam being written. Thank you.
Submitted my CPDs on the 1st of May 2025 before 12 p.m. and 2 of the 3 CPDs I submitted were marked, but the other one said submitted for moderation. Why did that happen?
Okay, thank you, Noctula. Can the intern contact the office? I think that one is a special case. We will need to investigate it. I can't really tell what happened at the moment. So if she can provide her PIN number, maybe we can check tomorrow. Thank you.
Sorry, Tabang, may I just add, the interns must just remember that not necessarily all of the POEs will be submitted for moderation. The system automatically assign 25% of the activities for moderation. So it can happen that one of your activities is sent for moderation or 4 of your activities is sent for moderation. It differs. So I have seen interns where I had to moderate all 6 of their activities. So it can happen that one is sent for moderation. And I know there was a few there was somewhere a problem, but the Bang, I think, spoke about that as well. Thank you.
Okay,
Our
yes, thank you, Rianda.
last question. I'm confused about when to edit and when to replace. I've done a flu vaccine campaign and the assessor said the audience was misleading. I want to explain why I use that evidence, but must I restart?
If it is a flu vaccine campaign and the assessor said audience was misleading, I'm not quite sure what you mean with that. It would be better to to start over. It depends on what your other evidence were, and probably, yeah, it's difficult if you don't, if I didn't see the evidence and exactly what you wrote. But for a campaign, it would be better to start over than to try and fix it. Where will you explain, in what part will you explain why you have used the evidence? So I would rather say restart with it and maybe look at the other comments made in the other steps, because it can be that it is not only the evidence and not only the audience, but there was issues with the other steps as well, and then it can result in you being not successful. That's how I understand. Thank you.
Thank you. No more questions.
Okay. Thank you, Noctula. This brings us to the end of our workshop, and I just want to thank all the interns and the tutors who managed to attend and remained until the end of the workshop. Thank you to the facilitators who assisted to guide the interns on what needs to be done in order to improve the quality of their submissions so that they can be able to be successful and book for the coming exams. So also the colleagues from the office, thank you for all the preparations. And lastly, I want to allow my senior manager to make the closing remarks. And that's all from me. Thank you so much. Okay, seemingly she's held up somewhere. So in her absence, like I said, thank you all of you for participation. And what I want to announce is that the interns have been given an extension to submit their portfolio of evidence up to the 6th of June, which is this coming Friday. So what I want the intern to take note of is that tomorrow from 6 in the afternoon or in the evening, the system won't be available until the following day at around 8. So don't attempt to submit anything tomorrow from 6 p.m. until 8 in the morning on Friday. And then again, the same thing will happen from Friday, 6 p.m. The system won't be available again. So you won't be able to submit. So if you wait up to 6 p.m., unfortunately, it means your entry will be late for submission. So I'm encouraging you to make sure that you submit tomorrow or Friday during the day to avoid any disappointment. Yes, I think that's what I wanted to make you aware of so that you don't get surprised when you're trying to submit and your entry is not going through. And with those few remarks, I want to wish you a good evening and goodbye.
Goodbye, everyone.
Thank you.
Good evening,
Bye.
everybody.
Bye.
Good evening. This was such a wonderful evening. I'm hoping you can all hear. As Tabang mentioned, we'd really like to thank the facilitators who are our assessors, our dedicated assessors, as well as moderators, to spend this time with you here to give you this wealth of information, and to all the tutors who've supported their interns and the interns who want to make this dream come true of successfully completing this internship here with a bang. We would like to thank you for taking this time to be here, as well as a warm, gratitude to our team from the office. It's quite a huge team that's here tonight. So we'd like to wish you happy submissions with this extended deadlines that the office has allowed you to have, and that this will be a successful journey for all of us, and see you on the other side when you are registered as pharmacists. Thank you so much. Good night. Hello, Tabang.